Hi, Mehul. Hi, Mehul.
Good evening, sir. How are you?
Good evening. Good evening. How are you?
Fine, sir. Fine.
Mehul, I just wanted one small point. Who is running the slides? Who would be doing it? You or Chavi?
I will run the slides.
I think you can drop my slide because a host to introduce a host is a bit of an embarrassment.
Yeah. We were prepared for everything just in case, I have to.
Hi, Mehul sir.
हाँ जी, सुमित हाय.
मैंने आपको राइट्स दे दिया है सारे.
आई थिंक रिकॉर्डिंग भी शुरू हुआ है, नहीं दूसरी जगह पे हुआ है.
हाँ, मैं यहाँ वहाँ पर लाइव कर दिया. यूट्यूब पर हो गया है, रिकॉर्डिंग वहाँ हो रही है. आप
हाँ.
अपने सिस्टम पर रिकॉर्ड कर लीजिए. रिकॉर्ड पर क्लिक कर दीजिए.
अभी क्लिक कर देता हूँ. Just give me a second. No? Yeah, I will start the recording.
Done. On your local system?
हाँ, local system पे.
Done. So I'm leaving now.
Okay, Sumit. Thank you so much.
Sure. Bye.
Bye.
Bye. Bye.
Good evening, Dr. Unnikrishnan. Welcome.
Good evening, Dr. Unnikrishnan. Welcome to the show.
Good evening to you. I'm just getting my settings ready. I will join you in a minute or so.
Sure.
Nice to meet all of you.
Sure, sir. Thank you. Basically, sir, I didn't know who is going to present, and also I made all the slides.
It's okay. You can put my slide, but you can just skip it after some time. I'll just say brief one line, and after that you can skip it.
Okay.
You can play it, of course, but you can skip it.
Yeah.
I'll just say next, so you can move on to the next to James.
Sure.
Would you like me to just practice my slides, or is it fine?
We are in practice section. You can practice, I think, sir.
No, in case you want me to just share my screen and have a look.
Sir, Mehul, it's your call.
Yeah, we can just have a look at it. Not an issue. No harm, I think.
So are slides visible?
Yeah.
And I'm audible?
Yeah.
Yes.
Okay, then that's fine. Then we are ready to start when you are.
Great. Super.
Dr. Unnikrishnan, are the images on your slides on the right part of your slide presentation? It's on mute. Yeah, now it's not there. Yeah, fine.
Can you see it now?
Yeah, I can see.
Yes.
I'll just go through the whole slide set.
Yeah, fine.
Okay, that's the last slide.
Fine, fine.
Great.
I'm not using PowerPoint. I'm using some other, software.
But
What's
it's
it-
visible, sir, not an issue.
Yeah. Okay. So I'll just mute myself and join as maybe 5 minutes before the event.
Sure,
Is that
sure.
fine?
Yeah, that's fine.
Nice to see all of you, and we'll
Yeah.
meet soon.
Our pleasure.
Same here, sir. Thank you. Shankar, sir,
Yeah.
I think there is light coming from your back. Your face is slightly dull. Ah,
Is it okay now?
absolutely. Yeah. I think others should join by 4:45 or so.
Yeah.
Chavi is also joining.
Yeah.
Hi, Chavi.
Hi,
Good
good
evening. Good
evening.
evening.
Hi, Chavi. Should I say good evening or good morning?
क्या था?
Well, I wish I was that lucky, but good evening it is.
Okay.
Yeah.
Chavi, all well? Hello.
Yes, everything's
Great,
fine.
great. The session is also getting recorded. Sumit gave me the rights. He
Yes,
has just
yes,
left.
yes.
Yeah. Dr. Unnikrishnan has just joined. We did the sound
Good
and
evening,
video check
Dr.
for this.
Unikrishnan.
Yeah, I think he will be joining 5 minutes prior.
Okay,
We did a sound and video check of his slides and everything, so it is fine.
great.
I'll be presenting the slides of the speakers.
So I am here on, as a backup, Mehul. If at all you need me, please let
Yeah,
me
yeah,
know.
I'll WhatsApp you. So
Yeah.
I'll be keeping my video on just as a participant.
Yes. Also, yes.
Ah.
Also, just be a little active on WhatsApp, please.
Yeah, yeah, that's what. So my phone is here.
I might bother you. Yeah.
Yeah, yeah, yeah. No, I understand.
Great. Thank you.
तो इसके लिए ठीक है, super.
We'll tell Shankar sir also to keep his WhatsApp active.
Yeah, yeah. You have the numbers of the speakers, or how is it? We can ask them to join just to. Shankar
Shankar
sir,
sir, please keep your WhatsApp active.
hello,
Shankar sir,
Shankar sir. Uh, Sir, keep your WhatsApp active.
I think he's unmuting.
Sir, request to keep your WhatsApp active. In case there is anything, we will message. Can you hear us?
I think no.
Hmm. Ah,
Okay. Shankar sir,
Sorry.
can you hear us now?
I can hear you. Yeah.
sir.
We were very scared. We were saying, can you please keep your WhatsApp active in case there's anything? I'll be coordinating with you over WhatsApp.
Yeah. Yeah. Even I will depend on you because if there's anything, I will give the show to you and go away.
No, no. Mehul, actually, in that case.
Banao bakra.
On my video for a reason. I never do it. This
But
is the
Chavi,
reason.
frankly
Sorry.
speaking, your voice sometimes it breaks in between. I don't know.
Yeah.
There is a lag that happens.
Very surprising though. Oh yeah, let me switch on my Wi-Fi. I'm not on Wi-Fi. Just 1 second.
Welcome, Miss Cheryl.
Hi, good evening.
Hi. I am
Hi,
Mehul.
welcome.
Good evening, sir.
Good evening. Good evening.
Okay, I'm just going to mute.
Sure. Miss Cheryl, if you have any slides or anything, we can have a quick
Okay, I
check.
just shared it. I shared them with 1 second.
I mean, just to see whether they are running
Yeah,
fine.
yeah,
on
sure.
their end.
I think they're working good, right?
Yeah.
Yeah. Doctor, good evening.
Mr.
Welcome.
Mehul, yeah.
So you will have to adjust the screen a little bit.
My screen.
Yes, sir. The camera is not capturing the face properly.
That
थोड़ा ऊपर करना पड़ेगा सर.
is this fine?
No sir, लैपटॉप के स्क्रीन को थोड़ा पीछे कीजिए, if possible.
एक minute.
जी.
Can you guide me how to do that?
Sir, either you can put the laptop on a stand, or you can just थोड़ा push कर लीजिए लैपटॉप के स्क्रीन.
Yeah, you
या तो
want
थोड़ा
me
पीछे.
to
हाँ,
do that,
exactly.
right? Okay.
Super. Yes, yes. Welcome, James.
You're on mute, James.
You're on mute. Welcome.
Can you hear me now?
Yeah.
Yeah. Good evening and
Okay.
welcome. Yeah.
We are just doing the sound and video check for all.
Thank you, Mr. Shankar. Is the light okay on my end?
Yeah.
Perfect.
Dr. Vinod, what a nice picture behind you.
That's a painting by, I believe, Ravi Verma.
Wow.
Oh,
So this is fine now? This much height?
Yes,
sir.
perfect,
Yes, sir.
perfect.
Sir, you have any slides to show?
Yeah,
Then we can. Then
I
you
already
can share.
shared with Mr. James. You want me to share the screen and try it once?
Just to check. Yeah. Yes, sir.
Yeah, I'll do that. Is this fine?
Yes, sir.
Visible?
Visible, sir.
Okay.
Great.
I like your title.
James, we are Chavi, myself, Shankar sir are active on WhatsApp in case, you know.
Sure. Okay.
So
Because of
request
anything.
you-
Okay.
Yeah, because request you also to keep the phone
Yes.
at your side.
On-
Yeah.
Yeah.
just
On
in
mute
case.
and on WhatsApp. Yeah.
Yeah, yeah.
I'll just message everyone just to be on the safe side. Okay. Put myself on mute for a second.
Yeah, sure.
Pause.
So all set, and we start
Yes.
soon.
Yes, yes. We will start in 5 minutes. Sure.
Hi,
So, Tony,
James.
good to see you.
Yeah, yeah, good to see you as well.
I got my jackfruit at the back.
I saw that. Hello, sir. How are you?
Hi, very
Nice
good
to see
evening,
you.
sir. So happy to have the opportunity to share the platform with you.
Please,
Very
please,
happy.
it's an honor.
Good evening,
And
everyone.
how are you, Cheryl?
Cheryl, how
I'm
are you?
very good. Now better. I've had a bad cough and cold last week, but now I'm good.
James, Miss Ishi Khosla has to join.
Yeah, I just messaged Ishi. Okay.
Great.
Sir, is that a Ravi Verma painting behind you, sir?
Yes, sir.
I miss
I'm
coming
sure
to
you
your
have
house.
seen that in
That's
one
what I
of your
said. I miss
earlier
coming to your
kind
house.
visits to my place. So.
Yeah, I remember your collection. Fantastic collection, yes, sir, has got.
Wow.
So next time I'm coming. I've always seen him at his clinic.
You're most
You will need
welcome.
2 to 3 hours. Huh? You will need 2 to 3 hours to visit us, because there's an underground room also with full of. Sorry, I should not talk
No,
like
that's
this.
fine.
But it's really amazing. I have never seen anything like this in my house, in anybody's house in my life.
Wow.
It's fantastic collection.
Yeah.
And at least how many Ravi Verma paintings, sir? 2, 3?
Around 9. 9 of
9, yeah.
No, you're on mute.
So,
James is on mute, yeah.
so Cheryl, where are you today?
I'm better today, but I'm still coughing. But I've kept some warm water. I think it's this weather change.
It's all over now.
Yeah.
So James, that picture of jackfruit in the back, is it a painting or a photo?
It's a
We can't make
painting.
out from. It's
Painting,
nice.
It's a painting. In fact, I'll give a bit of a story of that. I was invited to speak at a college alumni in Qatar. And as I entered there, there's a little girl, Abaya, who drew this for me.
Wow.
And so it was gifted at the event as a memento. And I couldn't leave there. So I said, okay, this is going to be my office.
Very appropriately, hoisted just behind your chair.
So she is, in fact, she is, it's a honeybee trying to lift
Yes.
the humble jackfruit up.
Interesting.
And in fact, that backdrop is River Periyar, where we live. So she combined my book and the jackfruit into one picture.
Nice. We start in 2 minutes.
We can start in 2 minutes. I'll just.
Yeah.
And Dr. Uni and Dr. Vinod and Cheryl, we do have a great anchor for the event, Mr. Shankar, very senior journalist. So we're honored to have him as well. So he will be doing the intro welcome as well as moderate the Q&A for us.
James, I'm humbled.
And a big fan of jackfruit too.
Yeah, of course. I have jackfruit trees in my house. We have been using jackfruit for quite some time.
Where are you based, sir? In which city now?
Palakkad,
Palakkad.
which is known for its abundance of jackfruits.
Yes, of course. From Kerala.
Yeah. And you are from?
From Ernakulam.
Cochin. Yeah.
So Cheryl, how's the COVID scene there? I hope your cough and all is nothing to do with COVID.
No, I don't think it's to do with COVID. I hope not. But nothing, as of now, everything is like the road and all, everything is fine. But I think the schools have decided to defer the date now. They're not starting.
Yeah.
They were supposed to start on the 1st, but I think they've deferred it. Hi.
James, you're on mute again. Hello, ma'am. Welcome.
Good morning. Good evening, rather.
Good evening, Ishi. Good to see you.
Hi, good evening. Just you were calling, James?
I was calling. So
Yeah.
Right. I think we can start now. It's 5 o'clock.
Yeah, we can start.
Yes.
Please mute your mobiles. Thank you.
Okay, we're starting now.
Yeah.
Welcome to the 22nd episode of Heal Thy Samvad, hosted by Heal Foundation. I am Shankar Raj, President of Heal Foundation. Today's dialogue is on efficacy of green jackfruit flour in medical nutrition therapy for diabetes. During jackfruit season, if one drives from Thiruvananthapuram to Palakkad or Kasaragod in Kerala, all that one will find are hillocks of jackfruit. It is considered as the jack of the season and master of all. It is loved and also sometimes hated because it is difficult to reach to the heart of the jack. You need to pour coconut oil on your hands to peel the fruit. Once done, it is heaven. Jackfruit trees are so useful that even the leaves were once used as spoons for taking kanji or gruel. Now comes a new finding and an eye-opener that green jackfruit can be converted into flour and is useful in diabetic therapy. To speak more on this, I'll introduce the speakers, and it's my proud privilege to introduce the speakers. Just to remind you that we are live on YouTube also. Well, it's my privilege to have Mr. James Joseph as the moderator. He's the founder of diet fiber brand Jackfruit 365 and the winner of India's National Startup Award 2020 for food processing and winner of the most innovative product in health and Wellness category at Gulfood in 2021. He was director at Microsoft and has 25 years of experience in North America and Europe for multinational companies like 3M and Ford. He's also the author of and bestseller of the book God's Own Office by Penguin. Of course, it's sometimes embarrassing for the host to describe the host, but still such embarrassing moments happen, and there is humor also in this. Well, I have more than 30 years of experience in the field of journalism and also been part of over 200 health writer workshops and 7 national health writers and editors conventions in the past 15 years. I was formerly associated with the New Indian Express as the resident editor of Karnataka and Kerala, and later took over as editor for MSN News. Currently, I am the chairperson of Organizing Committee of Heal Foundation Health Writers and Editors Convention and consultant with many media houses. Our first eminent speaker is Dr. A.G. Unnikrishnan, CEO and Chief of Endocrinology at the Chellaram Diabetes Institute, Pune. He heads clinical care and research education and also oversees a philanthropic rural diabetic care program. Co-authored the largest multi-center study of subjects with pancreatitis and pancreatic diabetics worldwide, in addition to his many other publications. He was former editor-in-chief of the Journal of Thyroid Research and Practice, former executive editor of Indian Journal of Endocrinology and Metabolism. He received the Jacob Memorial Prize for the Best Patient Care awarded by Christian Medical College, Vellore in 1998. Subsequently, the Subhash Mukherjee Oration Award for the Endocrine Society of India in 2011, and the Srivastava Award again in 2011 of the RSSDI, India's largest diabetes society. He also has a fellowship award of the RSSDI in 2017, and Dr. Sam P. Moses Oration Award by the Diabetes Association of India in 2018, Diabetes Excellence Award at Digital Diabetes Summit at Hyderabad in 2019. The next eminent speaker is Dr. Isi Koshra, practicing as clinical nutritionist, columnist, author, entrepreneur, and researcher. She founded a unique score-based nutrition app, which has helped people across the world to understand the science and art of eating right. She spearheaded a healthy food company in India, the Whole Foods, founded the Select Society of India. She was also involved in community service through the All India Women's Association at Delhi Commonwealth Women's Association. She was advisor to several organizations, multinational companies, and is on the board of many institutions, including her alma mater, Lady Irwin College at Delhi University. She authored many books: Eating at Work, The Diet Doctor, Is Wheat Killing You, The Cholesterol Facts, etc. She is a distinguished alumnus 2011 at Lady Irwin College, Women's Achievers Award in the field of nutrition by the Imperial and Cancer Patients AIDS Association, and Jabi Women Achievers Award. She has been felicitated by the President of India for work in the field of nutrition. She has also been listed among the 25 most powerful women in the country by the India Today group. The next speaker is Dr. Vinod Abhichandani, diabetes endocrine physician since January 1985 at Ahmedabad. He is the principal investigator, special phase 3 trial, post-marketing surveys involving insulin, OADs, and cardiovascular molecules. He is a member of AACE, that is the American Association of Clinical Endocrinologists, ESE, or the European Society of Endocrinology, Endocrine Society, USA EASD, that is the European Association of Study of Diabetes. He is a life member of RSSDI, fellow, and the Research Trust of Diabetes in India. He is a guest speaker both at regional, national, and international diabetes conference. He is at regional faculty at Ahmedabad for CCEBDM, CGGDM, CCMH, ACMHDC, CCDR, and NDEP. Frankly speaking, I do not know what all these stand for, but actually these are all eminent institutions. Next. We have with us also Ms. Cheryl Salis, she was awarded the Finer World Award for Change Marker in Social Media, recipient of the Ellen Trash Fellowship in 2021. She is the course director, visiting faculty, and trainer at various educational institutions, associations, and corporate houses. She's the author of award-winning book, Diet in Diabetes Simplified. She also authored patient education books like Nutrition Basics and Carbohydrate Counting, ISPAD LFAC, like this Healthy Eating and Carbohydrate Counting, Family Guide for Mumbai, an initiative of the Municipal Corporation of Greater Mumbai. She also is the co-author of Purple Book by FSSAI. She was selected among the 15 people in the world by ISPAD at Boston for special training in research in type 1 diabetes. She also features as an expert nutritionist on TV shows, print, and online media. So we have eminent speakers, and to carry forward this dialogue, I now hand over the platform to James.
Thank you, Mr. Shankar, for that great intro to Jackfruit, as well as to present all the eminent speakers we have today. And myself, I am an accidental researcher into the nutrition as well as in the science of jackfruit. I started this as a cause, as Shankar mentioned in the opening, that it is a nuisance that 80% of jackfruit used to go waste in Kerala. And to create an organized market for the underutilized jackfruit was the original reason why I got involved in promoting jackfruit. But in 2014, a sheer accidental discovery of the unripe jackfruit replacing rice could be good for controlling blood sugar. That accidental discovery, from there, my journey in converting or approving the benefits of green jackfruit for diabetes started off in 2014 April. But the reason I invited these 4 speakers today is because this did not happen because of my effort. The journey of that one discovery with a patient who was taking insulin and taking unripe jackfruit meal, a tradition in Kerala to replace rice, resulted in a hypoglycemic event. So from that, it took a lot of research, but a lot of help from a lot of eminent people, scientists, doctors, as well as a lot of patients who came to me with their experiences, as well as kind of handheld me in this journey. And that is the reason I personally requested each of these speakers to share scientifically as well as from personal experience about the efficacy of the green jackfruit flower as a medical nutrition therapy for diabetes. So I will introduce each of the speakers as well as provide the context why I invited them to be at this session, as well as a bit of our history of association in this scientific journey with jackfruit. And the first one, Dr. Unnikrishnan A.G. Dr. Unni, in fact, again, in an accidental meeting, I went to meet a great diabetes researcher who is known for the best research in reversing type 2 diabetes through low-calorie diet, Dr. Roy Taylor. In fact, I was supposed to go and meet him in Newcastle University, and then I found out he is coming to my own state, Kerala, for the Endocrine Society of India conference in 2017. I was in Kovalam. And as I was in the hall with Dr. Roy Taylor, I found a presentation where Dr. Unni and his team said they have also done a low-calorie diet study in India. In fact, the first one to do a low-calorie diet study in India. And that's how I met Dr. Unni. And from there, we continued conversations. I had been to Dr. Unni's hospital, Chellaram Diabetes Institute in Pune. And in fact, my meeting with Dr. Roy Taylor was to find out, is it possible to do a clinical trial on the green jackfruit as an alternate to rice and can we prove that through a clinical trial that it is actually good for diabetes? And that ask of doing a randomized controlled trial to prove that came from Dr. M.S. Velithan. Dr. Velithan told me that if you want the scientific body as well as the medical community to accept a scientific finding, it has to be a randomized controlled trial. That is the gold standard in proving efficacy of an intervention. So Dr. Unni then helped me understand how a randomized controlled trial is done, and in fact he was also helped me to do our first randomized controlled trial using green jackfruit flower in type 2 diabetes patients. So that is the context why and Dr. Unni has always been a sounding board for me. In fact, during your first meeting, I walked him through the nutritional differences between the unripe jackfruit versus a cup of rice or 2 rotis, and then he told me, James, this is what medical nutrition therapy is all about. So you should, but you have to prove that through a randomized controlled trial. And with that in context, I will invite Dr. Unni to walk us through the efficacy of green jackfruit flower in medical nutrition therapy, to give us an overview about medical nutrition therapy as well as how the study was conducted. Dr. Unni, welcome you to the program, and over to you.
Thank you. Thank you, Mr. James. And greetings to all the luminaries on the dais with me. May I ask if my slides are visible and if I'm audible?
Visible.
Yes. So
visible.
Yes. So let me start. So as you know, the anti-diabetes effects of jackfruit have been reported in some studies. Jackfruit is rich in dietary fiber, carbohydrates, vitamins, and minerals. The green or the unripe jackfruit is used as a vegetable. So to understand the efficacy, it's important to do a randomized control trial. And this was a randomized control trial which was published. And in the study, people of either gender, age 18 to 60 years, diagnosed with type 2 diabetes for more than 1 year and stabilized on oral anti-diabetes drugs and having an A1C of less than 8% at screening were eligible for the study. And it was a study in which Group A and Group B was studied. In one group, of course, green jackfruit flower is given. I'll come to the details now. So this was a randomized double-blind design and used was used in 40 participants with type 2 diabetes. Glycosylated hemoglobin, fasting, and postprandial glucose were determined at 0 day and also on the 84th day, which is 12 weeks. As you can see, the intervention was 30 grams of green jackfruit flower per day divided between breakfast and dinner. So in the study, in the step 1, jackfruit, green jackfruit flower or placebo was added using the measuring spoon. And as you can see, it was given as an add-on, as initially the green jackfruit flower was added and then the rest of the flour was added, and then the regular flour or batter and prepared daily food as usual was given. As you can see in this picture, you can see green jackfruit flour given for breakfast and for dinner, and you can see in the group B placebo flour, which could be rice flour or wheat flour. So this is a placebo here which was used was rice flour or wheat flour. And you can see these were the baseline characteristics of the study groups. In group A, the mean age was 46, and group B, the mean age was 46, so comparable. The rest of the features were also comparable between the two groups, including the duration of diabetes, which was 5.9 years in group A and 5.77 in group B. You will also find the change in all the parameters, the HbA1c, fasting, postprandial, and body weight. It's important to note that you can see that both in the group A as well as group B, in the green jackfruit flour group as well as the placebo flour group, there was an improvement, but the improvement was better in the green jackfruit flour group. And this difference in the change was statistically significant for all the parameters. It is for HbA1c here, for fasting plasma glucose here, for postprandial glucose here. You can also see that the mean body weight did not change. And these are values given in milligrams and millimoles per liter because both are used in different countries. And you can see the body weight, the p-value was not statistically different. So the body weight did not change in this short study. So you can see in group A, in which people were using green jackfruit flour 30 grams per day for 12 weeks, there was a reduction in A1C of minus 2.5%, whereas in placebo, there was a marginal increase and the p-value was 0.006, which suggested that green jackfruit flour could reduce HbA1c in this study. Notably, because the placebo flour contained rice and wheat, in this present study, jackfruit flour, and I'm sure our nutritionists on this panel will be better placed to talk about these intricacies than me and also talk about the isovolemic aspects of the methods used. Jackfruit flour had 25% lower calories, 33% less net carbohydrates, and 57% more fiber in comparison to the placebo group. And this suggested that jackfruit flour as compared to the placebo rice wheat flour may be a promising intervention to improve glycemic control as a replacement to rice or wheat flour. So the limitations of the study were acknowledged in the paper is that this was a small sample size, a short duration study. Placebo difficulties are there in any nutrition study. So for several reasons, to mimic the comparison as much as possible, because in one group you're adding jackfruit flour, in other group adding inactive substance made really no sense because you want to compare it to the standard of nutrition, which is rice flour or wheat flour, and therefore, but this also posed some placebo difficulties as in any nutrition study. This was a single center study done in Srikakulam district, and then in a government hospital, maybe in a largest multi-center study could give more wide, broad results. And the HbA1c was kept below 8%, because if the HbA1c is very high, then the chance for more aggressive therapy and hypoglycemia occurs. And then HbA1c was conservatively kept below 8%, also probably keeping in mind that people had to be reasonably stable in their glucose control, and highly unstable patients with high blood glucose may not be ideal for a nutrition study because the concomitant adding on of medication may make analysis difficult. So multi-center, multi-country powered study would be, of course, ideal for a large population for a longer duration, and people with higher HbA1c. All this may be needed to confirm the clinical significance and generalize these outcomes to a wider population. But for the present, the study showed statistically significant differences between jackfruit flour and the placebo flour. So from the study, we can conclude that green jackfruit flour, 30 grams per day, was found to be effective in lowering the levels of HbA1c, fasting plasma glucose, post-meal plasma glucose compared to placebo flour in people with type 2 diabetes, in which you replace an equal volume of rice or wheat flour in your daily meals. So that concept that it is a replacement which is giving you the medical nutrition therapy benefits is very important. And I've also highlighted what are the medical nutrition therapy differences that replacement of green jackfruit flour would make. One hopes that this small beginning in nutrition research of Indian traditionally available foods will make a meaningful context to changing research, to inspiring others to do similar research, and therefore bringing better diabetes care to people with diabetes. It has been a pleasure talking to you about this topic, and thank you all for listening to me.
Thank you, Dr. Ni, for that fantastic intro. And also, you make science much easier to digest. I still remember your comment to me that, James, keep the HbA1c below 8 because you don't want any change in medication during the trial to reduce the number of variables. So that was the reason why we kept the HbA1c relatively low, to make sure there is only one variable intervention here, which is replacing rice flour or wheat flour with jackfruit flour. Everything else remained the same, lifestyle as well as medication remained the same. So we can narrow it down to one intervention. That is, thank you, Dr. Nee. And with that, I will come to Dr. Ishi Ghosla. And in fact, my meeting with Dr. Ishi happened because I wrote a book. While I was submitting the final manuscript, I read an Indian Express article by Ishi, where she talks about jackfruit and diabetes. And there was one word which I didn't even know how to pronounce. The fiber in jackfruit is mucilaginous in nature. And I didn't even know what that was. So then I found out Ishi is also a Penguin author. So through my editor, I was able to get Ishi's phone number. And then when I spoke to Ishi about, that is the first time I understood the importance of soluble fiber versus insoluble fiber. And she told me that the jackfruit has more soluble fiber than other fruits. So that is a plus compared to the crude fiber, which you get from a lot of vegetables. So I had to research on it. And then, in fact, my second interaction with Ishi was after my meeting with Dr. APJ Abdul Kalam, where he told me to find a way to add the green jackfruit to roti and idli dosa. And I knew that, okay, so the only way to do that is to make a flour out of the green jackfruit. Took a lot of work, but the first sample outside my house went to Ishi's house. And it was supposed to be mixed with millet and to make a fulka out of it. And in the night, I get a call from Ishi saying that, okay, James, can you confirm that the blender which you use to make the flour does not have any wheat in contact? And I said, Ishi, if you ask me that question, my answer will be there will always be a chance of wheat. I can't guarantee you. She said, I like your answer because I have got 2 children. One of them is eating it. The other one is crying for it, but the other one I can't give it because of celiac reasons. And then later on, I was at Ishi's house, and then she showed me how a fulka is made with the jackfruit flour. In fact, that time it was 100% jackfruit flour. And I still remember when she opened the fulka and said, okay, you can see the full circle, saying that, okay, it became a complete fulka. And so that is how the association started. But every stage of this research and development, I would consult Ishi Ghosla, and then I would like, in fact, specifically I asked Ishi to walk us through the importance of soluble fiber in nutrition versus crude fiber, and also the importance of soluble fiber, which is, in fact, the reason why I brought it up is that I had to use the soluble fiber pectin in jackfruit to get the binding factor. So that is why I call it a flour, not a powder. So it has to be added to atta, and you should be able to make a fulka. And if you add this to idli dosa batter, the dosa should not stick onto the tawa. So if it has too much binding, the dosa will stick onto the tawa. If it has less binding, the fulka can't be made. So I had to find a balance in the binding factor using the soluble fiber pectin. And that is why the jackfruit flour is rich in soluble fiber. So with that in the context, Ishi, over to you. Look forward to your insights on soluble fiber.
Thank you very much, James. And first of all, congratulations. I have seen this project and the passion right from the beginning, so many years ago, almost 10 years ago. And when I wrote the article in the Indian Express, it was a revelation to me too, as a nutritionist, that a fruit which is so high in carbohydrates has been found to be useful in diabetes and other metabolic diseases. And but I didn't know that here was a gentleman who was actually working on it, and we would connect over a jackfruit. So that is absolutely amazing, and very, very happy to see the success of this project, which really has its place in current times when both the epidemic of diabetes and metabolic diseases, including heart disease and hypertension, etc., are really staring us in the face, not only for as the adult population, but among young adults and even children. So what you're doing is something which is absolutely, ripe and very, very important and very much needed. And when I say that, I have a special reason. This is not just any other, the impressive data which has been shared by you as an author in Nature and Dr. Uni Krishnan just before me was not surprising to me. It's so obvious that this flower will perform, beautifully. It seems like nature's gift for diabetics, because today we are managing diabetes not on the basis of carbohydrates alone. We are not managing diabetes on, just calories alone. We are managing diabetes as an inflammatory disease. And we are talking about anti-inflammatory diet, which is low glycemic and high in fiber. We are not managing diabetes in the conventional way. We said low fat, high carbohydrate, high fiber diet. It's not any of that anymore. And in my clinical practice, I see this almost a reversal of early onset diabetes with just, initiating anti-inflammatory diet. And to be very specific today, when I say that, we find that one of the most pro-inflammatory proteins in our diet is wheat protein, which is gluten. And the second one, thanks to wheat protein causing a leaky gut, is casein, which is the milk protein. And when you take away these two, highly pro-inflammatory proteins from an individual's diet, you are lowering the inflammation almost instantly. And we see radical drops in blood sugars. And but that's not it. Elimination is not going to just do that. We need alternatives. We need, when you take away gluten, you're taking away the basic staple of an individual, and that's not fair. And when I put in rice, it has its own issues. It is high glycemic and it is high in carbohydrate. And so when you have an alternative, which is not only an alternative because it doesn't have gluten, but it's highly anti-inflammatory, thanks to its phytochemicals, the flavonoids, the anthocyanidins, the tannins, there are so many other what we call phytonutrients loaded in this fruit, even carotenoids. These provide a very high value to this alternative. And secondly, it's very high, the fiber that you've been talking about. It's very, wheat, say, 100 grams of wheat will have about 2.7%, and this is an impressive 11%. And this is not only the percentage, it's like you said, a very good combination of soluble and insoluble fiber, both of which have hypoglycemic and hypocholesteremic effects. Having said that, the soluble fiber is also today, we know, is extremely useful as a prebiotic. It's also we are talking about healing the gut. We're talking about elimination and having an anti-inflammatory effect on the gut, which will have a cascading effect for reducing inflammation all over the body. Now, we also need to modulate the gut flora. All of this is being modulated by the various good microbiota which is residing in our gut. So this soluble fiber works as a prebiotic, and also the carbohydrate, which is the starch, is what we call resistant starch, and again, which works like a prebiotic. So you can see the reason why you are getting these impressive results in the studies that you're doing on management of diabetes. And let me tell you that this is only one small part of what jackfruit flour can do as an alternative flour to wheat and rice. You will be able to intervene and manage diseases, virtually every chronic disease that we are talking about. whether it is digestive disorders, whether it is cardiovascular disease, hypertension, cancer, autoimmunity, because when a food is impacting the gut favorably, it is providing fuel for the gut flora. It is providing, it has a hypoglycemic and hypocholesteremic effect. It is providing bulk. It is also going to be high on satiety. So even obesity management is huge, and you know the burden of obesity today. So by virtue of all these, the goodness of this vegetable, you will be able to really provide the world with a very, very impressive alternative to wheat and rice. And I, as a practitioner, have used it in my practice, even at home, and with favorable, very, very good results. At home, I can tell you that the children love the chapatis, and the ghee added to it lowers the glycemic index even further. And, like you said, it needs to be incorporated into familiar foods, which include porridge, which include breakfast cereals of other kinds, or rotis, or idlis, or pancakes, or whatever you have. Even bakery products, I would say. There is a huge potential that you have, unraveled through your chance project which has happened. And I think I'm not going to give you data. You have all the data with you, and all the listeners would be, will have access to it. But all I'd like to say is, in a nutshell, that this food needs to be researched further, to be introduced by the food industry and at the individual household levels, and made a part of healthy alternatives to wheat and rice. One of the biggest challenges for me as a practitioner is roti. Roti kaise? Roti nahi khayenge to kya khayenge? And and then when you say rice ki roti kha lo, so we know that there are problems with rice ki roti. And here is such an impressive percentage of fiber, and both the soluble and insoluble fiber. The mucilaginous aspect of it is one of the USPs of the health benefit. And also not only health benefit, but also, like you said, in its usage in culinary practice, how it lends itself to binding. And one of the things which gluten is all about is binding. So, when you take away gluten, it's difficult to work with the flour, especially with rice, because it doesn't have that binding capacity. And here is a product which is, which is so rich in pectin. When I also started a health food company way back in 2001, and we were making a lot of products which were gluten-free, and we were adding pectin to improve the binding. So here you have natural pectin, and so it lends itself to great products in the kitchen. And so I'm going to leave my session only saying that I really wish you all the best, and I hope we are able to bring this product to becoming mainstream rather than alternative.
Thanks a lot, Ishi. Thanks a lot. In fact,
Mr. James, can I have a quick question for a very impressive talk by Dr. Khosla?
Go ahead.
Sorry for that interruption, but I think I would at this stage like to ask that one. So you highlighted the soluble fiber content of jackfruit atta. And do I understand that this should be a very good alternative for all vegans who are probably abandoning all milk source of proteins and fibers?
Yes, certainly, because it is very high in it's the nature of fiber and the quality of fiber. Quantum and quality are absolutely brilliant. And it also, when you use the seeds, James, I'm sure we've spoken about it. When you grind the seeds with it, you also add valuable protein. So it could be a plant protein source as well.
Thank you.
So, which is high in fiber.
Because gluten-free is in vogue all over practically. that
And
really
so,
creates.
yeah, it
For
is.
people who are genuinely allergic, it's a different thing. But for
it needs to be practiced under, with care. Just going off gluten will not do it. Like I said, we need an alternative, a healthy diet with high in fiber, low in carbohydrates. A gluten-free diet can be full of rice and sugar. So it doesn't make a difference. So one has to, it's like being a vegetarian does not equal to being healthy. So a gluten-free diet also needs to be initiated in a proper way.
Jackfruit atta is a good option, alternative.
Brilliant option.
Thank
and
you.
It tastes very well.
Yes.
And Dr. Vinod, just to add on to that question, when we were doing the research on the protein, I had to do an amino acid profiling, and we were surprised to find 17 different amino acids in the flour. I'll share that report with you. That'll also help you. The quality of protein and the quantity of protein. You have 8 grams of protein in that, of which 17 amino acids.
That's very impressive. And when you combine it with a dal or a lentil, which is usually consumed in an Indian scenario, it would make a fabulous combination.
Sone pe suhaga, almost.
Yes.
And Dr. Shri, thanks a lot. In fact, I still remember your statement, James. Why are you mixing it with millet if you can make 100% full carb? The fruit is as good as a diet gets. Thank you, Shri. Thanks a lot. Okay. And with that, we'll move on to Dr. Vinod Abchandani. And Dr. Vinod in fact, I remember this one statement on Twitter, is that an elegant study has been done on jackfruit flour. And I was surprised by the choice of word. The elegant was the word which was used. But then later on, Dr. Vinod reached out to me saying, okay, James, I started using the jackfruit flour and I'm seeing some benefits at home. And then later on, he told me, I'm seeing some benefits at my clinic too. So when we were going to talk about the efficacy of jackfruit flour, we have seen the science and the clinical trial data from Dr. Uni. I thought I could invite Dr. Vinod to share experience both at home and at the clinic. So Dr. Vinod, over to you.
Yeah, thank you very much for that accidental inclusion that I am enjoying today. It's a great honor to be with all of you, all stalwarts. And anything that Dr. Unni touches has to be elegant, let me tell you. I mean, it's right from the bottom of my heart, I'm speaking this out. And Shankar sir, you read few abbreviations in my introduction. They represent all certification courses in field of cardiometabolic disorders, especially diabetes, and some of them come from Chilaram Diabetes Institute and rest from the Public Health Foundation of India.
Thank you. Thank you very much for the clarification.
So I am going to take off where Honorable Unni sir ended his research slides. So I'm going to translate that research into clinical practice and very humbly share my experience of just 2 patients. I have been specifically asked to share my experience in the clinic, my observations in the clinic with the usage of jackfruit, green jackfruit atta. I'm going to prefer atta to flour, and I hope all of you don't mind that. I believe green jackfruit atta is a nutritional gem. I'll start with the first case of my clinical practice. And this is a real world case I'm describing to you. A 58-year-old male patient with type 2 diabetes, hypertension, and dyslipidemia, that is lipid disorders, bad cholesterol high and good cholesterol low. He presented to me 5 months ago with a BMI of 29. At that time, he was weighing 85 kgs. He was on optimal, well-tolerated metformin monotherapy for the previous 12 months on a dose of 1700 milligram per day. He has received appropriate education in diabetes self-management, self-monitoring of blood glucose, that is SMBG, exercise, and meal planning. Hypoglycemia has not been an issue to date, luckily for him. However, SMBG readings have not been at go. And his mild hypertension, he has been additionally hypertensive, and it's well controlled with a quality fixed dose combination of antihypertensive pill. And he has been on atorvastatin 20 milligram daily for control of his lipids. These were prescribed by the previous physician before he saw me, and I agreed totally and just continued that. So when he came to me, I requested for some investigations, and these are the readings. HbA1c 7.8, fasting sugar 127, 2 hour postprandial, that was post-lunch, 207 milligram per deciliter. He had a triglyceride of around 152, fairly well controlled, close to 150, the cutoff, and LDL of 97, again below 100, and HDL at the minimum optimum level of 40 milligram for males. His liver and renal function were normal, and his cardiogram was normal. So I discussed his reports with him, and after reviewing the available therapeutic choices, normally we do this, use a shared decision-making model where we spread out all the options available in front of our patients and apprise them of the pros and cons of each available agent. And then finally, we mutually decided that he should be additionally on a DPP-4 inhibitor. We selected sitagliptin 100 milligram once a day. This was chosen based on the simplicity of use, tolerability, and the patient's wish to avoid any drug that might cause weight gain or hypoglycemia. And he also quizzed me about a newer class he must have read somewhere, or he must have Googled about SGLT2 inhibitors. And then I told him that because he is not circumcised, he can be facing issues of genitourinary tract infection. Then he agreed to not go for that. So 3 months later, HbA1c has come down from 7.8 to 7.4, fasting blood sugar 115 milligram per deciliter. It has also come down from 127 to 115, and 2 hour postprandial sugars have come down from 207 to 187. Not a very impressive correction of postprandial, because DPP-4 inhibitors are known to, that class of oral anti-diabetic agents are known to address postprandial elevations. But in this particular case, we didn't receive very encouraging correction. His lipids were more or less similar, liver function, renal function, and additionally, I had requested him to go for a fundus examination. It was almost 12 months since he had one, and that was normal. So this person with diabetes was reluctant to either increase the dose of existing bunch of medicines he was taking, specifically the anti-diabetic medicines, or add any new one. So he was totally shut to that idea. And at this point, I explained to him the benefits of replacing 15 gram of his rice batter or wheat atta intake twice per day by raw or green jackfruit atta, which is available online. He agreed to my suggestion and I requested him to share his SMBG readings periodically, 10 days after regular, twice daily start of green jackfruit atta usage. So this is the snapshot of those readings, some of those readings. And he was kind enough to take the trouble of pursue his post-breakfast, post-lunch, and post-dinner sugar levels on various days, as I had explained to him. So if you look at the day 11 after starting of green jackfruit atta, he had at that point, his sugars came down from 115 to 110 fasting. His post-breakfast sugar was 175. Then he had shared all fasting sugar levels. If you compare on day 11 to day 45, significant statistical decrease. Of course, I have not calculated the p-values, which is the benchmark of knowing the real efficacy of an intervention, but this is the real world data. So I was happy with the numerical reduction. In 2 hour post-breakfast done twice during, captured on this slide, from 175 on day 30, it came down to 144. And 2 hour post-lunch sugar from day 18, if you compare it to day 45, significant reduction. And 2 hour post-dinner. So because we had covered his breakfast and dinner with that 15 gram of green jackfruit atta, and I think it showed some impressive results, as all of you would agree. So on day 45, fasting blood sugar of 110 on day 11 came down to 92. And the postprandial sugars post-lunch, which was around 187 before he started his green jackfruit atta use, it came down to 142. So as can be seen, optimization of blood sugar levels was achieved within 6 weeks of regular use of green jackfruit atta in this patient. He has also lost 2 kg weight in the meanwhile, which is very reassuring. And his most recent, so this was done slightly, because I was keen on knowing what was happening to his HbA1c also. So this was done last week, where he has entered the 6th month of his follow-up with me. So the LDL, HDL, and triglycerides had an impressive, lowering from 152 to 137. And HbA1c came down from 7.4 to 7.2. That is also, let me tell you and remind all the August audience, whoever has joined us, that even a small drop in HbA1c percentage translates into major benefits in terms of decrease in at least microvascular diabetes related complications. And this is in the second part, observations at my home. I was very happy to hear from Dr. Khosla madam that she is also using at home, and we have been religiously using now since past more than 4 months. So since past 4 months, at least, we have successfully incorporated use of green jackfruit atta in recommended doses. So 30 grams per day total as a healthy food habit for each one of us. And we have found no change in taste, no bloating or undue fullness after any of the meals. And luckily, no other form of sinister intolerance. This happens to be my better half. I've been honest in capturing her data. And she's around 59 with a host of illnesses, a known case of obesity, osteoarthritis, hyperuricemia, lower limb varicosities, fatty liver, and hypothyroidism since past 10 years. And she developed type 2 diabetes 3 years ago, fairly controlled with a fixed dose combination of voglibose 0.3 milligram plus metformin 500 milligram twice per day with major meals. So this voglibose is another commonly used agent which is supposed to address post-food elevations of sugar. It should be able to correct those. And luckily, she doesn't have a history of hypoglycemia, hypertension, or any of the cholesterol abnormalities. And she happens to be under regular guidance and follow-up of a registered dietitian and a qualified diabetes educator. We have one of the most prominent registered dietitian and diabetes educator coming up after me to deliver an opinion. So physical findings I have clocked prior to and 3 months after starting green jackfruit atta. So you can, I think I will just look at the weight. She's lucky, I'm very happy. My wife is becoming slimmer, 89 kgs from 92. And a BMI has marginally come down because of static height. And these are some investigations and sonography findings before and after 3 months of green jackfruit atta use. So fasting sugars have come down from 110 to 99. These are all real data, nothing, at all manipulated. These are real data we have on record in our home. PPPS 176, that has come down to 151. HbA1c from 7.9 to 7.6%. She had fatty liver grade 2. I'm coming to that. And because of that, she had SGPT elevations. That 66 international unit has just touched upon the normal range. 45 was the cutoff for this lab. Uric acid, while she was on febuxostat, 40 milligram after dinner, that's a molecule to be given for correction of high uric acid levels. So that had been 5.6 prior to start of green jackfruit atta. It came down, luckily because of perhaps improved overall metabolic milieu, it came down to 4 milligram per deciliter. And at this point of time, I decided to give her a drug holiday. So I put her off on febuxostat. And creatinine, that is the kidney function test, and eGFR is the amount of urine formed by our kidneys every minute. Those were all within normal range both the times. Regarding our thyroid, she was on maintenance dose of 100 micrograms. She continues to be on the same dose. And thyroid function was unaffected. Her LDL, HDL, which luckily she has for her host of comorbidities, good HDL, above 50 both the times. That's a cutoff, desirable cutoff in females. Triglyceride came down again by a substantial amount, 21 milligram, 19 milligram. Fatty liver grading by a qualified sonologist was to my relief. It came down from grade 2 to grade 1. So what are the learnings from these two persons with diabetes? So how green jackfruit atta really helped these two individuals? They continue to use the green jackfruit atta and they are doing well. The addition of this nutritional gem helped correct the fasting sugars, postprandials, HbA1c, lipids, and fatty liver in my wife's case at least. And then it induced marginal weight loss, improved quality of life. So what is the scientific basis? I'm coming to the end of my presentation. Nutritionally, 30 grams of green jackfruit atta gives 108 kilocalorie. Net carbohydrate content is around 20 grams, and dietary and soluble fiber, to which Dr. Khosla madam repeatedly referred to. This very important component. Soluble fiber 4 and dietary overall fiber of 4 and soluble fiber of 1 gram. Compare it to the placebo atta, which could be rice or wheat, which was found in either case to contain 146 calories, higher carbs, lower dietary fiber, and 0 gram of soluble fiber. I think Dr. Khosla madam very repeatedly highlighted the importance of soluble fiber in management of diabetes and our day-to-day metabolic milieu, including our, she referred to a very important gut bacteria part, which is outside the scope of today's discussion. 3 phytochemical ingredients, including vitamin C, which is ascorbic acid, beta carotene, and lycopene, which have been found apart from a host of incredible amino acids and good things found in the jackfruit or green jackfruit atta, shared by Mr. James. These were found primarily responsible for the combined antioxidant and anti-glycation. So glycation is a process whereby bad things happen in a person with diabetes. So these ingredients confer a win-win situation for green jackfruit atta. And clinical trials conducted at Sydney University's Glycemic Index Research Services have found that raw jackfruit has a much lower glycemic load. So there are two terms. Glycemic index just gives a numerical figure and says how rapidly a given food can increase blood sugar, but how much that increases is done, both the functions are done by glycemic load. So I think I would leave it to Cheryl to, if at all she wants to have a comment on this glycemic index and load. We can replace, so in my final comment, we can replace a third of rice from our idli, dosa, appam, puttu, etc., and a third of wheat from roti, upma, puri, aloo paratha, etc., by green jackfruit atta, and we won't notice any difference other than a very positive change to our health. So thank you very much for your patient hearing, and I hope it was of some use. These are genuine, real-world clinical cases. By now, I have 15 of them taking religiously jackfruit atta daily. And perhaps over the next end of next 12 months, I'll be able to generate some more useful data of this wonderful nutritional product. Thank you very much.
Dr. Vinod, I can't thank you enough, because this is real. This is real world data. Okay, what we have in medical journals versus what you see in real people.
Yeah, and so as I was seeing Honorable Unnikrishnan sir's slides, I thought I'm going to replicate, perhaps copycat him, in my slides. So it was almost mirror image of what he has done in a very small population. Mine is smaller. I've just quoted 2 cases because of want of time. One of them has been my better half. I took her consent that I'm going to put up your data, and she was kind enough to agree.
Thank you, Dr. Vinod. And in fact, while I was looking at your slide, it's not just diabetes, and Dr. Ishi mentioned, it is predictable from the overall benefit which we see, because it is fundamental nutrition. It is fundamental, you are replacing something which is harmful with something which is very good for you. And that is what we have seen. And the reason why I only talk about diabetes is I restrict my comments to wherever we have prospective randomized controlled trial data based on the word I gave to Dr. Velithan. So hence, I mean, we will create prospective randomized controlled trial evidence against each of those benefits.
Indications later.
Correct. Yeah. And this are all
luminary of Dr. Khosla's standing. She is absolute authority. I also went through her, background because I was a bit nervous. I have such big guns on the dais, and I have to accompany them. So I think her observation was very, very accurate. That she commented so politely and so nicely that I was not very surprised by the findings of the trials. And I'm sure she is not at all surprised by the findings of my clinical patients' data. So, but anyway, I think her word matters a lot, and we can go to the next speaker.
Thank you, Dr. Vinod. And with that, I'll come to our next speaker, Ms. Cheryl Salis. And in fact, again, this is a chance meeting. I was invited to speak at a startup founders mentorship program as a speaker right after we won the National Startup Award. And in fact, now wherever I speak, at least one attendee has personal experience with the jackfruit flower. So in that case, most of the questions after the session came from Cheryl, and she was probing from all different angles. And then she told me, James, finally she told me, I am using the jackfruit flower in my practice, and I have a lot to share. So that's how we associated. And then later on, Cheryl told me that, okay, we have now got enough data to give you more of a scientific response as well about the impact it has done to our practice. So I thought none better than one of the best nutritionists and registered dietitian in the country to come and share her experience as a person as well as with the practice, with the large practice observation. So with that, I invite Cheryl to give us a perspective of a nutritionist overview on the green jackfruit flower and its efficacy in medical nutrition therapy. Over to you, Cheryl.
Thank you so much, James. First of all, thanks for this invitation. It's wonderful being with such excellent, renowned people on the panel, and I remember that discussion with you, and I'll tell you where it went. So basically, I'm from Mangalore, so I've grown up with jackfruit trees, and my mother's favorite is jackfruit and the raw jackfruit. And I think for people who are in the south, the ripe jackfruit is actually discarded. Nobody really eats it, And the raw jackfruit is what the vegetable is made of, and even the seeds are boiled and eaten, and that used to be our snack. And my mother is very fond of it, so it used to be definitely in our house at least twice a week. And yes, like Mr. Shankar said, the whole cleaning of the jackfruit is a big task, and that itself. So the person who's cooking doesn't like it, but the person who's eating enjoys it. So that is what it is about the green jackfruit, and we continue having it because that's something which has been very traditional to us. And I remember, speaking to a group of pediatric endocrinologists in Kerala and addressing them on type 1 diabetes. And that's when this question about, the green jackfruit flower and whether I've tried it and, what is my opinion about it. And honestly, I had not tried it then. And there was a lot of, questions that came about it. And that's when I heard about your product. And when I came back, I was really excited. And I told my team, I really want to try this. And, let us see how it works with our patients. So honestly, I tried it with a few of our patients, and I can share my, findings, and I'll share my slides because I'm going to take you through my presentation. Yeah. So one is I'll also speak about the science, and then, tell you about my experience with my patients. So while we dietitians are planning, so there's a lot that goes into meal planning. It's just not something like a sheet of paper that we give. Obviously, there's a lot of thought process that goes into planning. And when we're looking at obesity management, glycemic control, definitely one is to try and help the person achieve faster satiety. Looking at the dietary fiber, the resistance starch, and I think Ishi as well as Dr. Vinod have spoken about it. And when we're looking at cutting calories, especially when it comes to pre-diabetes, and today we're talking about remission of diabetes, and we're looking at, cutting down calories and a low-calorie carb-controlled diet, we still have to give adequate nutrition. So it has to be nutrient dense. We have to look whether it's a low to moderate GI, low to moderate glycemic index. So there's a lot of thought process that goes when we are planning the diets and the ingredients that we are going to put in. And when it comes to the jackfruit flour, we all know about this. So when we're looking at 200 grams of rice flour or 200 grams of wheat flour, and the corresponding amount of, the jackfruit flour. So 30 grams of jackfruit flour replaces 50 grams of wheat, rice, or millet flour because of the isovolume effect, the low bulk density of the jackfruit flour. And again, this is something that has been highlighted by Dr. Vinod as well as Ishi. So basically, if you look at this, even for 30 grams of jackfruit flour versus 50 grams of wheat flour, millet flour, rice flour, the amount of soluble fiber is even more higher, even for a smaller volume. So for 30 grams, you're having 1.65 grams of soluble fiber versus zero point 0.8 which is there in wheat flour, 1.2 in your millet flour, and 0.5 in rice flour. And when we're looking at glycemic index and glycemic load, now, we have a list of, glycemic index of different foods. And when we're looking at GI, whether it's a bajra roti, because everybody with diabetes or, people wanting to lose weight, they would switch to having a millet roti, thinking it is low in carbs, it is low in calories, and they would have the same amount or even more at times. And if you look at the GI of a bajra roti, it's around 67. A maize roti is around 64, and then you have all the different varieties, the recipes of your Indian foods. But whereas if you look at your jackfruit flour, it has got a GI of around 65 and a glycemic load of 17. So it's basically a moderate GI, moderate GL. But what is really striking it has high amylose content, and we know that high amylose makes the GI lower, and also type 2 resistant starch and a good prebiotic. And today we're all talking about prebiotic and probiotics. So even when we're planning a diet, we're trying to give foods which are natural prebiotics, because gut health has become a very, very big thing, and we know the importance of having good gut health. Now, we all do CGMS for our patients. I'm just going to share with you one CGM data of a patient. So this is how week 1 looked when the person was having, the wheat roti and the millet roti. And then when you shifted them with, adding 30 grams of jackfruit flour to the diet, and this is how the blood glucose levels are, improving. And this is what we see with our patients. In fact, they say that when they were eating 3 rotis, now they're eating only 2, because the satiety is achieved much faster. And the postprandial blood glucose levels are definitely much better. So where we seeing a PP of around 180 or 200, now the PP blood glucose levels are in the range of 140, 130. And they feel so happy and motivated that just one change about just adding jackfruit flour to their regular meal has brought about an improvement in their blood glucose response. Now, this is a very interesting study where they actually try to incorporate jackfruit into different recipes. So, either as a chapati, so 100% as chapati or a puttu or an idiyappam, and 50% you're adding to idli, or 25% of jackfruit flour adding to appam, dosa, porridge, and upma. And they tried to do an assessment in terms of what is the kind of acceptability in terms of taste. And chapati had the highest score. So, and we all know, and our patients have been using it for their chapati. Rice appam had moderate acceptability, whereas upma had a lower score. So, at least when it comes to the recipe, so you don't have to just confine it to having, only for the chapatis. In fact, our patients added to their idli dosa batter. And some of us are, even including me, and I've had this conversation and discussion with you, is we actually just mix it with regular just curd and have it with meals. And I tell my patients to do this, before the meal. So, you add one tablespoon of jackfruit flour to a cup of curd and have it, and then you have the meal. So one is that you're adding fiber, and we know the food order. So, adding fiber and protein to a meal And beginning your meal with fiber and protein helps to blunt the post-glycemic blood glucose response and also achieves better satiety. And this is what our patients have been doing. So one is improved gut health, second is early satiety, so calorie restriction, and also better postprandial blood glucose responses. So this is something that is really working well with our patients, whether it's adults as well as children. We've been using it even in children, and we've seen very good results. In fact, the parents of children are really surprised because the amount of insulin required is also going down, and that's a huge motivation for the children as well as for the parents. And that has only motivated me to prescribe it more to our people and especially when it comes to weight loss. I think people are looking for satiety and something which is not going to change the taste of the product. Very, very important, because I think we are all wanting tasty food. So you add something which is not going to change the taste or the flavor of the food, and this is what fits in really beautifully. And this is a little feedback from some of our patients who've been using it. So the first thing, I've just copied it as it is. So no distinct taste is the first feedback. So our parents are very happy when it comes to children. Even the adults who are using it are very happy because they can just add it to curd or just add it to the dal or to the rotis. Weight loss, early satiety, and improve postprandial blood glucose responses. So this is what is in my clinical experience with my patients, and I've also been using it. And honestly, it's done a world of a difference to our practice. Thank you.
Thank you, Cheryl. That was a great overview. And from a nutritionist point of view, and especially, you mentioned about the taste and the taste impact for children. And that is what, in fact, without changing eating habits. In fact, let me give that one comment that Dr. Kalam gave me, that James, changing eating habits is worse than changing religion. And that is why this idea of a flour, that it took me 18 months to crack this. But being able to add this to fulka and idli dosa was the challenge which we are trying to crack. And in fact, the example which I used was how iodine was added into salt without a change in taste. And that is the attempt which we tried. And thank God we were able to crack that. And then you're just giving an example, and no better judge than kids. If they're happy to eat it, we know it has no impact on it. So with that, we have got a great overview today from Dr. Unni on the scientific side in terms of the design to the low HP A1C which we used, and the impact at the clinical level, as well as peer-reviewed and published data. And then Dr. Ishi walked us through why it is so predictable from the fundamental nutrition of the product itself that those results are no surprise. Okay, and it's beyond diabetes, but we have clinical evidence for diabetes right now. And then Dr. Vinod gave us a fantastic, real world data, with multiple areas. And then now we got Cheryl giving an overview about a range of patients, including continuous glucose monitoring, how the impact within a week. We have seen from the 10th day to the 45th day with Dr. Vinod. And you have shown it from week 1 to week 2 using continuous glucose monitoring about how the range is coming down. Okay, so this is, all we are saying, it's the property of natural jackfruit, what Dr. Ishi mentioned. It is when you're replacing rice or wheat with a natural jackfruit, it is poised to happen. This result is expected. Okay, that's the first part of it. And you don't need to look beyond medical nutrition therapy to see the reason for the efficacy. Okay, it's fundamental medical nutrition therapy. In fact, Dr. Unni, in his closing comment, mentioned that, okay, this is an opportunity for us to bring medical nutrition therapy to the forefront. Okay, and as you said, there is no change in taste. So there is no resistance to, in fact, when I was in the US, replacing a pasta with a salad was easy. Okay, it is medical nutrition therapy because salad as a whole meal is possible there. But we don't have an alternate like that in India. Okay, to replace roti, like Dr. Ishi mentioned, without tearing the roti, the meal is not complete. Okay, and that is the biggest hurdle for us to overcome. In roti ke bina khana adhura hai. In fact, I keep hearing this. So here you can actually continue to have your regular food without changing eating habits, but bring in a nutritional correction with just 1 spoon of jackfruit flour breakfast, lunch, and dinner. And that is the intervention which we have brought in. But the results which we are seeing is nothing but medical nutrition therapy effect, which is what is recommended in the American Diabetes Association standard of care. So we are not stepping outside the current guidelines. It's within the guidelines. We just made it easier for us to get that nutrition therapy control by just replacing an isovolume or equal volume of rice flour and wheat flour with the green jackfruit flour. There is no other rocket science here. We just, managed to prove it through a randomized controlled trial by removing the placebo effect as well. So with that, I will thank all the speakers and hand it back to Shankar. We have seen some questions already coming in, and over to you, Shankar.
Thank you, James. Thank you very much. I think we have a lot of questions coming in. So I'll be quick in asking my questions. The first question probably Ms. Ishi can answer. This is about, can we replace wheat completely and replace it with green, this flour, and will it lead to hypoglycemia? You're on mute.
Ishi, you're on mute.
Yes, the replacement of 100% replacement of wheat with jackfruit flour is totally in order. I don't think it is. The body is an amazing machinery and has an ability to regulate and manage blood sugars. Unless you are a diabetic, in that case, it will cause hypoglycemia. So it depends on who you are. If you are diabetic, certainly it will cause hypoglycemia. 100%. So you need to tweak your drugs, etc. But if you are normal and you're not diabetic, then the body self-regulates blood sugar levels, and you will get the benefit of the fiber, a mild, maybe a hypoglycemic effect, but that does not mean that you will get hypoglycemia per se. It should be within your permitted levels, and there shouldn't be a problem.
Dr. Unnikrishnan, there are 2 points of the question. What do you think is or are the active ingredients? And secondly, the study has a small sample size. So do you plan to expand your study and have multi-centric double-blind studies?
Dr. Ni, you're on mute.
So the first thing is, it will always be good to do a multi-center study to look at, to have more data. But I think this particular study has given statistically significant results. And this particular study itself is a very challenging study to do. In fact, nutrition randomized control trials are not easy. So I think this study itself is giving statistical significant results. Having said that, more data is welcome. The second point about the active ingredient, I think this is a success of standard medical nutrition therapy. There's more fiber, there's less calories, the carbs are also in control. And like Dr. Cheryl showed, the bulk density effect and the isovolemic effect of the same 30 grams when you look at wheat or rice. I think that is a key to the success. So it is a success of application of standard medical nutrition therapy. Again, I'm speaking as a clinician and also as my understanding of the results of the paper. But welcome Cheryl and Ms. Cheryl and Ms. Ishi Khosla to opine on this aspect.
Absolutely, just to add to your answer and the response, that the satiety value, like Cheryl mentioned, is very high. So if you, like I said, the body has an amazing ability to self-regulate volume of food and the blood sugars and other parameters. So the chances are that if you eat 2 chapatis regularly and you're replacing them with jackfruit flour, you may not be able to eat those 2 chapatis, or you may undereat. The next meal would be smaller. So the body has a great ability to regulate. So you shouldn't worry about hypoglycemia.
Cheryl, your thoughts?
I just would like to add, I think this is exactly what our patients tell us. And also it prevents the snacking, because what happens is they feel hungry again later, and then there's an evening snack. And that is the biggest culprit, I think, we see with our patients. So when we want to do calorie restriction, I think it gives you better satiety and keeps you full for a longer time.
Dr. Vinod, there is a question for you that if you find certain patients progressing well using this jackfruit flour, will you recommend after a period of time a drug holiday as you described?
Not the drug holiday for anti-diabetic medicines chosen. Maybe I may lower the doses and assess the patient closely. But I think putting them off all medicines will be very challenging, and it may be counterproductive. So it's a person who comes to me for a very regular follow-up, I'll be able to perhaps bring down the number of tablets or individual dose of the tablet. That I can.
Fine. Ms. Cheryl, I think there are two questions in the chat box. One is it safe for pregnant women to use this, and also renal patients?
I think it should be safe. Renal, again, there's a lot of it that goes in. We have to look at the potassium levels, etc. So we would definitely watch the biochemical parameters and then prescribe, because renal is a completely different, situation, because you have to look at the electrolytes and all that, and therefore it would be very customized. And when it comes to pregnancy, yes, it is safe and can be consumed in moderation.
Yeah, fine. These two questions were from Tina Khanna. I think must be satisfied with the question. Now I'll come to you, James. A very controversial topic. What is this huge drama about metformin hydrochloride?
Okay. So anyway, thank you for addressing the elephant in the room. Okay, so let's be clear. It was scientifically investigated by the drug department and the food safety department of Kerala's drug inspectors and food inspectors jointly went to shops in multiple districts and took random samples with the chain of integrity established from the shop to the lab, and they found nothing in it other than jackfruit. Okay, so first of all, as you heard it from today, all you need to look is medical nutrition therapy to see the effect. You don't need anything beyond that. Okay, so it is, as it mentioned in the pack, it's a single ingredient, which is 100% green jackfruit in flour form, nothing else. Okay, there's a reason why I kept it as a single ingredient, so that there is absolutely no iota of doubt. Am I getting something natural? The answer is it is only one ingredient. Okay, that is what is on the pack. That's one. Second, that specific case is a mischief, potential crime, and that is being investigated. But on the scientific side, both the food controller and the drug controller has issued reports and statements that it is absolutely safe for this product to be consumed, and it has no other compound they could find. Okay, so that is, it's been, so I don't talk about it because it's been clearly, swiftly, and decisively dealt with by the respective government regulators, and it has been put out as a notice. So it's unfortunate that, when we talk about scientific evidence, peer-reviewed scientific evidence versus what's up forward, but unfortunately, that is how the society is. But we are definitely, our approach is scientific. In fact, when Dr. Ishi mentioned about it is not just diabetes, we make a conscious decision not to talk about other benefits till we have the scientific evidence peer-reviewed and published. That is our approach, because it is for the long term, and we would like to have it, the scientific evidence. Otherwise, all these eminent speakers won't be here if I am somebody who is willing to take shortcuts. So I won't do it. Thank you, Shankar. Thank you for raising that question.
I don't think it has at all dampened anyone's enthusiasm to prescribe political.
Yeah, but as James said, we need to get this elephant out of the room. So
yes,
I think that's more important.
Yes.
So the next question is probably Ms. Ishi and Cheryl can answer this. This is, I'm a diabetic while celebrating the new year that is just around the corner. Can I take sweet dishes and then top it up with a spoon of green jackfruit flour with yogurt to normalize my sugar levels?
Absolutely not. It's like people having Karela before having gulab jamun and thinking it's going to nullify their sugars. That's definitely not. And please enjoy your sweet also. So today we don't like, I think people think dietitians are only going to say no, and we just give a list of avoid foods, and that's not true. Science is advanced. And today we say you can eat everything in moderation. And anything, even in if it's healthy and had too much, is not good for health. So so in moderation, watch your sugars, monitor, and enjoy the festival.
Oh, that's wonderful. Because
In
the
fact, I
moment,
have, I think people, I have one parent who's actually making muffins with jackfruit flour as well. I'm going to take the recipe from her, and she's adding jackfruit flour even to the muffins.
oh, that's wonderful. That's wonderful.
And she feels very happy because his child sugars are very, very good. Without insulin in the evening as a snack, she's making it, and he goes to play, and he comes back with bang normal blood glucose levels.
Fine, fine. Ishi, do you want to answer? Do you want to add anything to that?
I just endorse whatever she said, and the fact that this person who is wanting to indulge in sweets maybe should watch the diet in the morning and in the lunchtime and before she goes for the party, and she can balance her intake of sweets accordingly. And maybe whatever starches she has, she can replace with jackfruit flour. That would be a better approach than to use it like an antidote.
Yeah.
Yes.
This is because in India, the moment you mentioned that this particular thing is good for reducing your glucose level, the next question that naturally comes is, can I have my sweets? So
yes.
that is a natural question that comes after all these things.
Yes, and that is something with all health foods. People believe, oh, this is low fat, low sugar, so I can eat this, and then I can eat any amount. And therefore, advertising for health foods has been controlled in certain countries. And just a comment, I'm very, very tempted to add this to James' comment, that we don't have to wait for clinical research for foods which we know are genuinely effective and efficacious. Well, the time, it may take years for the researchers to come by, but it doesn't mean that we wait and we do not propagate good food for other, something like jackfruit for other reasons. We know it's fiber rich, we know it's phytochemical rich, we know it's anti-inflammatory. So if it's good for all of that, we have no reason to wait for research to support that. It can come, and it's very much needed in place. But I think this is a fatal mistake which is happening with a lot of traditional wisdom and traditional foods and herbs in India, and we are not able to utilize them because they're just brushed aside and said, oh, there's not enough research. Oh, there's small research. This was not a good paper. We don't have to. We know that they have been used for centuries and they should be used. And researchers will follow. So as a nation, as a country, I feel very strongly about this, and I don't want the jackfruit fate to be compromised in any way. You should go full on.
I second Rishi completely on this. Sometimes,
Right.
it's very difficult when we have to talk evidence, but, even our clinical practice and what we see, I think that itself is sufficient enough, and we are so convinced about it. I think all of us are convinced about it, and that's why we are here.
And during
Thank you.
COVID, all the medical practitioners were just doing shots in the dark. Nobody knew what drug is going to work, what will not work. There was no evidence, but still we were doing things which had no background. But so, I mean, if that can happen in modern medicine, why do you have to wait for good stuff to get the right
Thank you,
place?
Ishu. If I were to add one comment that, why I even attempted the randomized controlled trial, once it was in the flour form, it was possible. It was possible for us to, because these patients were going back home. Okay, so it was so easy to add to their idli, dosa, and roti. So, I mean, in fact, when the journal reviewed our study, they said it's very rare to find a randomized controlled trial in nutrition, and that too a placebo-controlled one, double-blind placebo-controlled one. So that should be recognized. So it is possible for us to do clinical trial because it is in the flour form. It's possible for us to remove those. But as you said, when it is fundamental, why do you need to wait for studies? So diabetes being a large population disease, it will reach many homes. And as Cheryl mentioned, that'll also get into the muffin. It'll get into every food. In fact, one frequent question which I get is, how do I take it with rice? In South, rice meals, chapati, it's so easy. And that is where Cheryl's suggestion of adding it to curd and have it before your meal so that you feel full, so you end up taking less rice. So people are devising many ways to do it, and then they start seeing other benefits. And once I have enough data, then I have the confidence to go and complete a clinical trial. We are not stopping anybody from using it for, especially gut health has significant effect on multiple diseases. But thank you for the comment. I still need to make sure everything is regulatory compliant. Hence, I am on the cautious side. As such, you can see there are risks associated with health food. So unless we make sure we are on the right side of the law, and that is part of the reason why I'm taking a very cautious approach.
Yeah,
thank you.
Yeah, the next question is, since this also affects satiety and it reduces the quantity of food, does this help in controlling or reducing obesity?
Naturally.
Naturally, yes.
It's a natural outcome that if you feel full, you will eat less. And with the fiber, you also have a reduction in absorption of fats, and sugars. So it will work at multiple levels.
And can non-diabetics in my family, including children, also consume dishes made using green jackfruit flour?
I think it is not medicine.
That's exactly what we are talking about. Yes.
It can. I think we never thought about it when we were having our green jackfruit vegetable, right? We were having the seeds. It wasn't medicine, and this is also not medicine. It's food.
So it's safe.
I think Cheryl, I shared in my slides that whole of my family, including all my house staff, everybody now eats rotis where we have replaced 30 grams in a given day by green jackfruit flour. So I think it works for non-diabetics also. Obesity, big indication, future indication, if not today, officially it is approved. But I think I have observed marginal weight loss in my wife as well as the second, most of the patients. All of them have been overweight or obese.
The next question is, will I get the same benefit as green jackfruit flour for diabetes if I consume ripe jackfruit or tender jackfruit known as kattal? Dr. Unikrishnan, probably your comments on this.
Mute.
Well, I'll defer to Cheryl, Ms. Cheryl or Ms. Khosla.
Ishi, you can take it.
Well, it will not give you the same benefits because the resistant starches and all of those get converted into sugars. So it will become different in its properties and may have more available free sugars, which will change a lot of profile, the entire profile. So that will be different. Having said that, I'm not discouraging anybody from eating it like a sweet fruit. Then it is to be treated like a fruit rather than an alternative to flour. And, the benefits, the carotenoids and the phytochemicals, all of those will be there. The fiber benefits will be there, but it will change the profile for sure. So we will have to account for sugars.
Yeah. And Cheryl, you had mentioned about jackfruit seeds. Now, one problem with jackfruit seeds is that when you consume it, you have a feeling of bloating. Is it right?
Yeah, if you boil it and you consume it in moderation, I think that is fine. If you consume too much of it, then definitely. But otherwise, it is in moderation. It is great.
I think James, you will agree that in Kerala it is taken even as a side dish to rice.
Correct. And Shankar, just to add to that comment about kattal and the ripe jackfruit, just want to make a distinction. Kattal is tender jackfruit, where the soluble fiber value is much lower, and it is used along with roti, not as a replacement to roti. So then you end up having, and kattal is so tasty that you end up taking an extra roti. So your calorie goes up. So that is the reason why the kattal consumption has not seen the same benefit, because unless you replace, it's an isovolume replacement of rice and wheat. That is where you see the benefit. So it has to get inside the roti. There has to be a reduction in atta and an increase in vegetable. In fact, what we have done is people are eating more roti and less sabji. We made an atta from sabji and solved the two. That is the simple intervention which we have done here. So kattal, unless it reduces the roti, it won't have the same benefit. Ripe, you're taking it on top of your food and it is more sugar. So as Ishi mentioned, it is a fruit. Whereas the unripe jackfruit, the mature unripe jackfruit, the green jackfruit flour is replacing rice and wheat. That is why you see the significant benefit. I just want
James, one small question to you. Where is this flour more popular in India? Is it in your own state or elsewhere?
I mean, as Cheryl mentioned, chapati is where it is been kind of like a magnet. Anybody who is making roti, they find it, and the fulka fluffs up, and that is the biggest gain. So the number one use case scenario now is the roti consuming population.
Fine. I think it was a wonderful session. We have also slightly crossed the time. But before I close, I would like to have one last comment from all the speakers, starting with Dr. Unnikrishnan.
Thank you. Thank you for asking me. I think the most important active part of green jackfruit is medical nutrition therapy. So that was shown in the studies, shown in the real life examples presented by Dr. Abhichandani, and was also alluded to in the comments by Dr. Khosla and Dr. Salis. So this is the most important message, that it is good application of medical nutrition therapy.
Ms. Ishil?
Well, I'm an optimist, and I do see this baby step towards making awareness about jackfruit, very, very important. And I do see this scaling up very fast, and therefore a word of caution when whatever we do, whenever it's successful, be it grains, be it milk, be it animal protein, we tend to then use malpractices and the wrong methods to cultivate more. And I hope that doesn't happen with jackfruit.
Dr. Vinod?
Yeah, I believe Mr. James has successfully rediscovered a 3,000-year-old nutrition powerhouse. And let me clarify in regard to the question put to me, that it cannot replace oral anti-diabetic therapy. It's a part of MNT, and it aids in correction of hyperglycemia and perhaps other benefits that I've alluded to, weight and triglycerides, some of the lipids. Thank you.
Cheryl?
I think today we're all talking about lifestyle interventions as the first, thing in whether it's obesity management, whether it's diabetes or any condition. And, it's rightly like use food as medicine and not medicine as food. So I think if people use it in the right way and they're able to prevent diabetes or prevent obesity, because we see the latest data from the National Family Health Survey, the numbers of people with obesity, whether it's women and men, both in rural as well as urban areas, has gone up. So I think it can be included in the family meals, and we're definitely seeing improvements. Yeah.
I think this was put up on Twitter by Dr. V. Mohan, sir. Chennai data was there.
Yeah.
Yeah, so one last comment from the jackfruit man himself.
And I just want to thank all our speakers, just to reconfirm it is scientific, it is medical nutrition therapy, nothing else. And that is it. It's just food, nothing else. It's a fundamental correction to our excess carbohydrate, excess rice and wheat in our daily plate. And we have just made it easier thanks to Dr. Kalam's ask. And, as Ishi mentioned, for almost 80 years of work has gone into it to bring it to a form which is very easy to just one spoon, just add it every meal 3 times a day, and let the natural property of jackfruit do wonders to you. Thank you.
Thank you.
Yes, I'm just going to add one more comment. In the backdrop of the pandemic, which is tearing us once again in the face, irrespective, it has a huge role to play in building up immunity with the properties and the profile it has. Its significance is even more today than probably ever before.
It's extremely important, yes. Thank you very much. Thank you all for this wonderful session. And we hope to see you more in the future. Thank you. Thank you all.
Thank you, everyone.
Thank you.
And good
Thank you,
night.
Shankar.
Thank you.